we're doing chemo in the bladder. In urology, Dr. Weiss is going to be starting this, so we need to know what to do. I'm going to start with the text roll. Tech roll is you're going to get 2 bags. One's going to go direct to your nurse and go in the poly. And then you're going to have a bag. You're going to set this up at the beginning. You're going to have a blue clip. These are going to be found on the chemo cart. It has yellow on it. Think yellow for chemo. And then a fascicle, which is a sterile piece. That's going to come also on the chemo cart. All you're going to do to set up your bag is take the cap off. You're going to give that to your nurse. They're also going to send that to pack you. Then you're going to take your fascicle, and there's a little blue cap on there. Blue cap is garbage. Then on the blue seal part right here, you're going to connect like a luer lock. Just do it nice and tight. You're going to take your clip, and about 2 to 3 inches down, you're going to go ahead and clip that onto your bag. Okay, then put that aside. Once you're doing your 2 RBT, you're done. You're going to take the drapes off and clean like normal the patient up, and we're going to be moving the patient over to the cart. They're going to go on 2 chucks. We're going to use 5 chucks total, but they're going to go on 2 chucks. The reason why we're moving them to the cart is because if you have spill any chemo or have a question that there's chemo on the bed, there's no way to tell between chemo or just regular saline. So you would have to clean it up extra special and throw everything into a yellow bin. The text roll at this point is just to stay sterile. After they clean up, just stay sterile, keep your gown and gloves on, and you're done. So now the nurse's part is in the beginning of the case, before the case, they are going to make sure they get syringes. It's going to be a slightly larger bag than this, but it'll be a yellow bag. Do not open the bag. You're just going to make sure that it's for the correct patient and to check all your drug pads. The doctor is supposed to order the medication prior to the case, and pharmacy will drop it off on whatever floor they're going to make it to. So now we have the patient over in the cart. Then as the nurse, before the doctor is allowed to give this, you're going to take 2 more chucks. I'm getting up around me. So you have 2 more chucks. They're layered on top of each other. You're going to put this under the patient's genitalia area as best as possible. Okay, and place the chemo bag just right on top of that. That's fine. Then, as the nurse, you will have a set of sterile gloves on. Our sterile gloves, 1 layer is rated for chemo. So they will open the bag.
Now you're the surgeon.
I am the doctor.
Here you go, Dr. Danielle.
So I will take the syringe out. It has the other end of the fascicle on. What this allows it to do is it doesn't allow it to go through without it being connected to the other parts. So let me actually. So we put that end of the fascicle on. So just connect it. We never twist them off. The doctor will put it in there. Once he has the 2 syringes done, the nurse will seal the bag, take their gloves. We'll take that, take the first layer chucks out and their gloves and put it in the yellow bin. So now the doctor also will put their gown and gloves in that same yellow bin. You might have to remind them. Now that the patient's ready to go up to PACU, while they were injecting the chemo medication, you have to make sure you clock that time. So if it's 7:45, we make sure we know to put that in the MAR. When you put it in the MAR, you're going to put it as given by provider. You are never allowed to give this. The surgeon is the only one who's allowed to push this. So put it as given by provider. Otherwise, it looks like you gave it in the MAR. We're also going to be putting stickers that are located on that chemo cart. You're going to put one right here near this connecting point, and another one where they can open it up, because we don't want anybody to open this part up. So now you have your time, you have everything. You're going to take one more last checks, number 5, and we're just going to take and sandwich the patient with it, and they're ready to go to PACU.